A stroke occurs when the blood flow to a part of your brain is blocked or interrupted. This prevents the brain cells from receiving the necessary oxygen and nutrients to survive. It is a medical emergency that requires immediate treatment. Identifying the symptoms of a stroke can help you get help as soon as possible. Even though stroke symptoms may appear suddenly, there are potential warning signs in certain situations that should not be overlooked. This video will teach you how to identify potential warning signs of a stroke. We'll also look at the risk factors for a stroke and how you can reduce your risk. Okay then, let's dive in. Predicting a stroke is not always possible, but some people may have warning signs that need attention. A severe or unusual headache. While not always the case, certain types of headaches can signal an impending stroke. A recent study of 550 adults revealed that 15% of study participants experienced a sentinel headache before an ischemic stroke. In this context, a sentinel headache is defined as a headache that occurs 1 week before the stroke event. The researchers noted that these headaches were either severe or different from any previous headaches. It was found that headaches that started within 7 days of a stroke often lasted until stroke symptoms occurred. Moreover, participants who had a warning headache before a stroke were more likely to have atrial fibrillation, a type of arrhythmia, than participants in the control group who didn't have a stroke. What is an ischemic stroke? An ischemic stroke is a prevalent type of stroke that occurs when a blood clot blocks one of the blood vessels supplying the brain. On the other hand, a hemorrhagic stroke is a less common type of stroke caused by an artery in the brain that ruptures or leaks. A sentinel headache is also considered a warning sign of an impending aneurysm rupture. It's crucial to take any severe or unusual headache seriously, as it could indicate a more severe health problem. A transient ischemic attack. Another possible warning sign of a stroke is a transient ischemic attack, which is also called a mini-stroke. A transient ischemic attack happens when the blood flow to a part of your brain is briefly interrupted. Although the symptoms of a transient ischemic attack can be similar to those of a stroke, they typically disappear within an hour and do not usually cause permanent damage. However, in some cases, symptoms can persist for up to 24 hours. Although the symptoms of a transient ischemic attack usually only last for a short period, it is essential to seek medical attention immediately, even if the symptoms disappear. While a transient ischemic attack may resolve quickly, it can indicate that a more severe stroke may occur in the future. In fact, research shows that about 1/3 of people who experience a transient ischemic attack will have a more severe stroke at some point in their lives. A recent study has confirmed that experiencing a transient ischemic attack increases the risk of stroke. However, the occurrence of an acute stroke within 90 days of experiencing a transient ischemic attack has decreased in recent years. This suggests that the measures taken to prevent stroke after experiencing a transient ischemic attack may indeed be effective. What are the symptoms of a transient ischemic attack? Symptoms of a transient ischemic attack are similar to those of a stroke, but they usually resolve quickly. If you notice any of the following symptoms, get medical attention right away. Paralysis or weakness on one side of the body, usually in the face, arms, or legs. Difficulty speaking or understanding. Trouble seeing in one or both eyes. Loss of balance or coordination, trouble walking. Confusion. Headache. And dizziness. It's essential to get a medical evaluation within 60 minutes of the start of symptoms to identify the cause of a transient ischemic attack. This can help ensure that you receive the correct type of treatment, which may lower your risk of future stroke. According to research, timely diagnosis and treatment can prevent up to 80% of strokes after a transient ischemic attack. In the case of an acute stroke, treatment within 3 hours of symptom onset leads to better outcomes with fewer long-term issues. What are the risk factors for stroke? Anyone can have a stroke, but these factors increase your risk. High blood pressure. High blood pressure is a leading cause of stroke and the most significant controllable risk factor. Diabetes. Having either type 1 or type 2 diabetes makes you twice as likely to have a stroke compared with someone without diabetes. High LDL cholesterol. High levels of LDL cholesterol, commonly known as bad cholesterol, can lead to the accumulation of cholesterol in the arteries. Heart disease. Some types of heart disease, especially atrial fibrillation, significantly increase your risk of stroke. Smoking. Smoking damages your cardiovascular system and blood vessels, making it easier for blood vessels to rupture or for fatty material to accumulate. Sex. Men are more likely to have a stroke earlier in life than women. However, women tend to live longer than men, so they have a higher lifetime risk of stroke. Age. Stroke can occur at any age, but your risk increases with age. What can you do to reduce your risk of a stroke? Although you may not be able to prevent a stroke completely, you can take steps to significantly reduce your risk with the following preventive steps. Try to keep your blood pressure within a healthy range. Know your cholesterol levels and have your cholesterol checked at least every 5 years. Get checked for any heart issues and follow a treatment plan as needed. Monitor and control your blood sugar if you have diabetes. If you smoke, consider quitting. Maintain a moderate weight. Try to exercise all or most days of the week. Eat a diet that limits saturated fats and cholesterol. Take any medications to manage and treat known health conditions. So, this was some crucial information regarding the stroke. Remember, if you ever experience symptoms shown in the video, seeking medical attention is critical. I also strongly recommend watching the video on how to dissolve and prevent blood clots naturally. See you and stay healthy.